So most PCN staff fall within the R's funding. What should a PCN consider for these staff for areas like long-term absence through illness?
So you're absolutely right. So the additional role reimbursement scheme is where most and all the clinical roles within the PCN are funded from. And the first question when you're then starting to consider some of the protection challenges is really simply to say, well, what sort of percentage, what sort of capacity might there be left within the additional within the R scheme? Because with the absence of one of the R's funded roles, you can apply to continue to fund any sick pay arrangements you might have through the R's funding. But whether you can then afford to get a replacement in depends upon the capacity you've got left. So the first question you've really got to start with is what percentage of our R's funding are we using now or planning to use in future? Because if you're getting towards capacity or at capacity, it means there's very little left or none left to find replacement costs from. So if you start by looking at the sort of the capacity side of things, of what you can do within the R's funding, then you're looking at trying to work out which job roles are essential. And it's the conversation that I'm regularly having with primary care network sort of management teams is that when you're getting towards that capacity, part of your contingency planning for your PCN is to then say, look, which of the roles that we fund are essential that we have to maintain because that's essential for delivering patient services. It could be that you could argue that all the roles are essential, but there might be within that some that you say, well, actually, we don't want to live without it, but if we had to, we could. So what you're trying to establish is what funding do we have? What roles do we have to replace? What will that actually cost to do? And where does that sit within within the network? Simon mentioned legal structure. Well, that's part of that. Who employs people? Who have got the responsibilities? And then once you've had those conversations, or even earlier in the process, talk and get some specialist advice. It's the conversations that our specialist financial advisors are having regularly now with primary care network teams across the country, and it's that sort of process of capacity, essential, contingency plan. What can we do about solving those problems?